The many different causes of liver damage, such as drug abuse and the excessive consumption of alcohol. But the most common and dangerous cause of liver inflammation is viruses. The viruses that cause hepatitis are classified into types A, B, C, D, and E, as Dr. Ben Kingi, a specialist surgeon at Mulago Hospital, explains.
Now, to differentiate what that particular patient has, you would need to do some blood tests and verify.
A survey carried out by the African Health Sciences Department at the Makerere Medical School in 2005 found that hepatitis B virus infection is highly endemic in Uganda, especially in the northern region, with more than 1.4 million adults chronically infected.
Hepatitis B is at about 10% of our population. Hepatitis C has been identified to be at about 3%.
As such, lots of awareness has been created about hepatitis B, giving little attention to other hepatitis types, especially C, which is equally dangerous.
Because hepatitis B and C are spread through blood products, but they are distinctly different. It is the particular agent, the viral agent, which has been identified.
48-year-old Frederick Chiinji is a survivor of hepatitis C. He lived with the condition for over 10 years without knowing it until a decade ago, when he was diagnosed with liver cirrhosis.
They did the tests and things like that, and they came back and said, "Oh, Fred, you are fit for liver transplant. We can't do a liver surgery. We need to pull all your liver out and we get a new liver."
Hepatitis C, we know, causes liver cirrhosis, which is liver scarring, and that happens progressively, slowly over a long time. If it can be arrested early by treating the infecting agent, then you can give the liver the freedom to recover. But if that is not done, you might present with a liver failure now.
Chiinji needed a compatible donor to have a liver transplant. Fortunately for him, his son Laureen Balu offered to donate part of his liver. In 2014, Chiinji had the transplant at a hospital in India.
Of course, we had done all the tests and everything was matching with mine. With love to Dad, he donated part of his liver to me. It was planted in me by Dr. Basanti, and I stayed there about 3 months.
At first I got scared and I couldn't tell whether I would survive or not, because they told me that they would cut my body and remove the liver so that they can decide if my daddy can stay alive for some good years, because there was no other alternative.
2 years later, Chiinji is fully recovered, but he has to take ARVs for all his life. His son's liver has also regenerated and he does not have to take any medication. Chiinji is one of the few hepatitis C patients who have survived. He thinks he might have been in a better position to avoid getting to the advanced stage of the illness had he known about it earlier.
I was skinny, like 20 kilos, dark black, like this seat here, very dark yellow eyes. When I look at you, like you say, a lion going to kill you, hungry to eat someone.
According to Dr. Kingi, many of the hepatitis C patients do not notice the symptoms as early as those with hepatitis B. A patient with hepatitis C may, however, present with any of these symptoms. Jaundice, a condition that causes yellow eyes and skin as well as dark urine, stomach pain, loss of appetite, nausea, and fatigue, to mention but a few.
C may be milder in its presentation and more subtle, and we are also seeing fewer of the cases of C. So it's possible that it may be missed. For instance, the patient may test for hepatitis B because a doctor suspects hepatitis B and requests for specifically hepatitis B tests and misses to test for C. So that patient passes through the sheath and is exposed to a longer suffering from C. C might cause more injury over the long term.
Hepatitis C is transmitted through blood or body fluids of an infected person.
Health workers deal with blood. You could say they are more prone to that infection. The armed forces dealing with blood in the courses of their normal work, accidents or firearms. They are also at high risk. The general population is at risk too.
Medical studies show that hepatitis C virus can also be sexually transmitted, although this is much less common. The World Health Organization estimates that 2.3 million people globally living with HIV are co-infected with the hepatitis C virus. The study also found out that HIV-infected people are on average 6 times more likely than HIV-uninfected people to have hepatitis C virus infection. As much as the prevalence of hepatitis C is still reported to be low in the country, medics think many more people are still silently succumbing to the illness due to little awareness.
The acute phase may last up to 6 months and the patient may get better. It may progress to the chronic phase beyond 6 months. And the changes that the patient may feel, complaints may feel, may be mild, may be attributed to another illness like malaria, on and off and so on. So a patient may ignore and not know that actually there is hepatitis C infection.
At the most advanced stage, hepatitis C causes liver cancer, just like hepatitis B.
Hepatitis B has got a vaccination you can give to prevent it. So far, hepatitis C has not got a vaccination, so you can't prevent it, like I had mentioned earlier. So you need to be able to diagnose it at its earliest form.
The good news, however, is that hepatitis C is a manageable illness.
Of all viral illnesses, it's actually a viral illness, including HIV, a viral illness that can be cured using the more modern medications.
Recent statistics from the World Health Organization rank Uganda as the 11th country with the highest number of people dying of liver disease, with over 41% of every 100,000 people succumbing to liver illness. Gertrude Tumusiime Uwitware, NTV.